Yeah. Hello, I'm Dr. Mehakinder Singh. I'm consultant nephrologist and kidney transplant physician based at Sohana Hospital, Mohali. So, in today's session, we are discussing about chronic kidney disease, what are the classical symptoms of chronic kidney disease, and what patients should not ignore. So, CKD is quite common nowadays. It is already affecting approximately 11% of adults worldwide, and around 15% of the Indian population is affected by CKD. So, in CKD, kidneys gradually lose their ability to function effectively. So, according to KDIGO data, CKD has been labeled as any renal dysfunction which is present for at least 3 months. So, renal dysfunction could be in the form of albuminuria, that is passing urinary protein, or it could be some urine sediment abnormalities like blood in the urine, hematuria, any electrolyte abnormalities, any histological abnormality on kidney biopsy, or any history of kidney transplantation. To say as the patient has a decreased GFR, it should be less than 60 for 3 months. That is the definition of CKD. So we all know there are 5 stages of CKD. So CKD stage 1, if there is some abnormality but GFR is okay, that is more than 90 or equal to 90. Stage 2, 60 to 89 GFR. Stage 3A, GFR of 45 to 59. 3B between 30 to 44. Stage 4 is GFR of 15 to 29, and stage 5 is less than GFR of less than 15, that is end-stage kidney disease. So what are the main symptoms of CKD? So the main symptoms of CKD are fatigue, any swelling which is there all over the body, any change in urination like patient passing more urine at bedtime, or there is shortness of breath, or any vomiting, decreased appetite, cramps, itchy skin. So these are the most common symptoms of CKD. So what are the various factors which are responsible for causing chronic kidney disease? The most common factors nowadays are diabetes mellitus and hypertension. So family history could also lead to CKD. Obesity is a very important cause of CKD. So it's very important to identify CKD and manage CKD at the earliest so that we could prevent or slow the CKD progression. If CKD is not treated at early, then it could lead to rapid worsening of renal dysfunction and early dialysis initiation in such patients. So it is very important that we see what are the factors which are responsible for CKD and manage them accordingly. So to manage CKD and reduce the risk of complications, what all we need to see? Number one, regularly monitoring the patient's GFR and albuminuria. Number two, controlling the blood pressure and blood glucose levels if the patient is hypertensive, diabetic. Number three, managing anemia and electrolyte abnormalities in a patient. Number four, addressing the bone health, that is using phosphate binders or vitamin D supplements to address hyperphosphatemia, hypocalcemias. To keep number five, keeping the patient active, that is regular exercise, smoking cessation. Number six, educating the patient about their care plan. And in advanced cases of CKD, considering dialysis or kidney transplant. So it is very important to early detect that the patient is having CKD so that progression can be retarded. Number two, to prevent complications, it is important that we manage CKD properly so that the patient does not land up in fluid overload on hyperkalemia or hyperphosphatemia. Number three, blood pressure is very high in patients who are usually very high in patients who are suffering from chronic kidney disease stage 5. And it is very important that we control blood pressure because it's one of the important factors which can be modified to prevent the progression of CKD. Then diet plays a very important role in CKD. We need to focus on a diet slightly lower in protein, lower in potassium, lower in phosphorus in patients who are suffering from chronic kidney disease. But the patients who land up on dialysis, they can be given a diet of protein of around 1.2 gram per kg per day. So improved quality of life can happen if we early manage CKD because that can reduce the progression of CKD, it can reduce the symptoms, it can improve the overall quality of life. And once the patient has already progressed to the advanced stage, it is very important for a nephrologist that we continuously monitor. And once advanced stage sets in, we can start considering the patient for renal replacement therapy. The vascular access is one important thing which should be looked upon once the patient reaches CKD stage 5. And other dialysis options, not only hemodialysis, but peritoneal dialysis should also be explained to the patient. So this is in short about what is CKD, what are the classical symptoms, how do we manage, and what the patient should not ignore if the patient is suffering from chronic kidney disease. Thank you.